I want to talk a little bit about the program first. Um, we do a survey of all the students at the end of their first semester. And one of the things that came out when we were sort of reviewing in prep for this is the concept of spiral learning and like trust the spiral and whatever. And so my question is, if somebody wants to talk about what spiral learning is, maybe from the instruction and then the learning side, and how it's different than a regular PBL or what it really means to somebody and how it's what you're a med student, what does that mean? What's going to happen?
Mm. Maybe I can start, but Isabel is really good at all of these things, education as well, and can probably give a more sophisticated answer. I guess the first thing is to mention the problem-based learning that Anya brought up. So all of your learning is anchored around a clinical case, and this is a really common form of your learning. Actually started at McMaster University, is really known for PBL, so people might be familiar with it. Um, so you're learning in small groups, which again is a huge advantage meeting people. But we try to anchor all your learning around a clinical case. So it's relevant, it's contextual, but the learning is integrated. So you're not just thinking about why is their sodium high, you're also thinking about, listen, they don't have secure housing and they've got some grief. So you're thinking about all the different social determinants of health, and we wrap all the learning into a case. So it's all integrated because patients are integrated. They don't just walk in with a high sodium, and you need to be thinking, and we're really focused on thinking about the whole person. So that's the first thing around problem-based learning. Spiral learning is a concept in medical education and happens at most universities, but we do commit to pedagogy and to learning style and education quite strongly. So in your first year, we focus a lot on normal physiology. So you might do studying of the heart, cardiology, and focus a lot on normal. And then in second year, more on the pathology. So you get to sort of revisit concepts, and then you'll do a cardiology rotation in your clinical years. And that's the sort of spiral. And from a learning perspective and sort of a cognitive neuroscience of learning, the more you spiral, the more embedded that learning is. If you just have a block once in med school on something, you can kind of cram it in and then you forget it and then you lose it. Whereas what's important in medical education, we know the exams are important. We know you have to pass, but we're really focused on you being a great doctor day one of internship, whether it's in Canada or Australia. So that's our focus. I know a lot of students end up just thinking about the exam and I've got to pass that, but we want you day one as an intern to be really the best doctor you can be, and then lifelong to have the skills of lifelong learning. So problem-based learning and spiral learning also teaches you how to learn as a doctor so that you're continually learning and spiraling, figuring out, what do I already know about this? What do I not know that I need to know to treat this patient? And then how do I go and fill that gap, critically appraise the literature so that through your whole life you're spiraling? So that's my answer, but Isabel might have some more context as well.
Yeah, I'm understood it perfectly, but I would just add that problem-based learning is a bit like sort of a who done it. There's when you're presented with the case to start with, there's just a little bit of information given. And so there's a lot of sort of group thinking and thinking big picture. And then gradually you're given a little bit more information as the case goes on until you're almost, trying to say, yes, well, I think that person, killed that person in the library with a candlestick or something. It's that sort of who done it type of scenario. And it's actually really fun. But what we then do with the spiral is a little bit later, we might present a different case with some of the elements of the last case, but it looks different. So, for example, the first case might be, someone who's lost a lot of blood and they might have something wrong with their kidneys and this, that, and the other. But later we'll present a problem with someone with problem with the kidneys, but a little bit more complicated. And so you build on your base information, which to start with is, very broad, and then gradually we revisit information, but it looks a little different. So you're made to think about applying. This is what's going on in the educational background. I'd be curious if Ria and Anya know this is going on, but you're made to apply these principles that you've seen before to a new situation. Think, wait a minute, I've sort of seen that before, but it looks a little different. And now I'm learning it in a bit more depth. And that goes on really, as Rebecca says, the whole 4 years in different ways.
Perfect. So maybe just on the kind of teaching side, the consumption of that, Anya, can you talk about maybe Anya and Rhea, what is your day like, or what is your week like? How are you? What is med school like for you? You're getting the cases that Isabel and Rebecca described, but what does kind of maybe a week or whatever look like?
Yeah, I mean, I don't know if we have the same schedule as Sydney because I know it was kind of different. So I'm not 100% sure. But Monday morning, we'll show up, we'll start a case, and we'll get, they're called triggers. So it'll just be like, patient has, presents with this. And then I'll give you some context about where they're from, some other general history, depending on the case. It can be really broad, and you're supposed to pull info from that. And then you take that starting case, and you'll sit in your group for, I think it's, yeah, 2 hours to go over the first case, and you'll be pulling out every single context clue you possibly can, be like explaining why it's relevant, coming up with what else you need to know to be able to actually use that, and then anything else you want to add to your study points for the week. And then over the week, you'll have lectures, you'll have labs, you'll have clinical skills sessions, um, and it'll all kind of tie into that so that by when you get to the Thursday, it'll be fairly clear, at least so far. We'll be able to come to an answer pretty quick after actually learning about what we're doing. And there's definitely been times where something we didn't like PBL a few weeks ago will come back up again. And then you're like, oh, yes, this was important. I remember we didn't think it was important the first time, but now we know that was important, kind of thing. Um, and in terms of just the general studying, like it's a fun way to look at because instead of just being like, oh, here's a lecture on, I don't know, anatomy of the stomach, whatever, it's more like, how are we gonna, why do we need to know about this to figure out the problem, I guess, if that makes sense.
Yeah.
So it makes it more fun and makes it more like a challenge. I was saying that there should be prizes for the person who diagnosed the patient first, but that's just me. That might be fun if you guys want to add that in. Anyways. But yeah.
Rebecca, sorry. Rhea, how is this? What is your year two like?
Yeah, so kind of like what Prof. Anglin and Prof. Carriage and what Anya has mentioned. So we do have PBL, which is problem-based learning. You are paired up with a doctor, a clinician, and then you're with other medical students. So in year two, in year one, you're with a tutor every single session, but in year two, you have one session where it's just you and your peers, and you actually get to put your heads together and have that foundation from first year to tease out more of the clinical like details given in that trigger. And then we also have once a week, we have these things called CDT, which is like a clinical debriefing tutorial. And this is the one bit that Notre Dame does really well. It's the public population health. It's the professional and personal development. So we do talk about these things in the context of being a doctor, of being a student. And then later on in the week, for first year, you have a 2-hour CCS session, and that's where you learn all your clinical stuff, like taking a pulse, taking the respirate, intubating someone, or even like suturing. In second year, however, it's basically that on steroids. So it's a 4-hour clinical session, and you learn twice, thrice more than you do in first year, but that's only because they're preparing you to then go into your clinical years and third year. And then obviously all throughout, lectures are sprinkled. At the moment, they're all online based. So they're live, they're synchronous. Sometimes they're not, sometimes they're recorded, but you do get the option to watch last year's recording as well. So it's very flexible in terms of what you want to do. But you do have to do the lectures because, well, you do your learning through them as well as your PBL because lectures supplement what you do in PBL. So